Hi, Oliver. Thanks so much for participating in this interview for this working trials group for a ketogenic diet and the future of ketogenic diet research. You were a participant on our ketogenic diet pilot trial, and I just wanted to ask today to give a sense to people at this meeting, what was your experience like with ketosis, with the ketogenic diet intervention? And I guess overall the question I want to ask is, what effects do you feel that the ketogenic diet has had on your life since participating in this pilot trial?
Well, I've had bipolar 1 since 1993. And when I started the ketogenic diet, the changes for me were incredible, actually. And they happened very quickly. I think within the first 2 or 3 days, I started to feel a lot more grounded. The ups and downs of, I guess, sugar highs and lows, which had been far more connected to my mood than I'd appreciated before the diet, they started to even out. And I noticed I was becoming much more relaxed and much less reactive. And I felt more grounded. It was almost like this sometimes my experience of bipolar is it just kind of gnaws away in the background. It's just kind of there. And there's this kind of something, agitation. And that just seemed to calm down, which was really amazing. And another of the positive benefits was that my levels of anxiety pretty much disappeared. I won't say that they've completely vanished, but to all intents and purposes, I stopped suffering from anxiety, which was tremendous. It was really, really good. And I guess after it's probably a few weeks, I noticed my brain started to work better, which was fantastic, particularly because I was about to start a degree at Edinburgh University, and I was genuinely worried about, can I actually cope with the cognitive side of things? Because I've heard from a lot of people that lithium particularly tends to affect that. And it seemed that the whole keto thing has really helped that. Interestingly, I stopped the keto diet after about 3 months because it was quite hard work. I did have to go out of my way to eat different food. And I guess within 2 or 3 weeks, I was back to normal. And then I started the diet again, and I had exactly the same experiences that I had the first time, which was fantastic. And I'm very grateful for the whole thing. I'm grateful for the project came along at the right time.
Thank you. And how do you feel about this as an area of research in bipolar disorder? Do you think this is something that should be carried forward and that could benefit other people with bipolar disorder? What would you like to see in the future? Should this area of research continue into the future? And do you think it has potential to help more people with bipolar disorder?
I think it's got a lot of potential. I don't think that any treatment can help everyone all the time. I think that's unrealistic. But I think the possibility of filling our brains with lots of nourishing fat and reducing the sort of sugar-busting carbohydrates is probably going to be really good for a lot of people, not just bipolar people, but certainly my experience is that even if 1 in 10 people with bipolar had a similar experience to me, it'd be more than worth it. So yeah, I do.
Fantastic. And so you'd mentioned the reductions in anxiety as, did you notice when you were, could you describe what it was like coming on and off the diet, how you noticed things shifting? You're saying that you'd come off the diet for a period and come back on, and you noticed this shift between those states. Could you describe that and what that was like to come on and off the diet?
Yeah, I think initially going on the diet was pretty easy. I didn't have any noticeable kind of keto flu. Although I did notice that I had stronger side effects from lithium. So I actually lowered my dose a tiny bit, which seemed to work very well. But I've been doing that on and off for years, kind of tinkering with my dose with the support psychiatrist or with my psychiatrist. But then when I came off the keto after, I guess it was 3 months, I think I was on it, I didn't notice an initial reaction. I noticed that I really enjoyed eating all the junk food that I had managed to stay away from. That was great. But I think, 2 or 3 weeks later, I was more reactive. I was less able to relax. I was more kind of on the go. There was nothing, it wasn't that my mental state had moved into any kind of hypomania or anything like that. I just wasn't as relaxed and content and at ease with myself. And then kind of the signs kept coming at me that I should go back on keto. You know, people kept asking me about it, and I kept seeing adverts for it, and I sort of would remember what it was like, and I thought, I've really got to do this again. I've got to try and commit to it this time rather than do it because it's the scientific study. And so again, when I went back on it this time, I think I had much more of a keto flu experience this time. But also it's February, so it could have just been a cold, who knows? But again, very quickly, I felt that sort of relief of being back on keto. And I think because I've sort of been on and off it, I've sort of tried with and without, it's easier to be more committed to it now.
Thank you. And I just have one more question, which is this conference is a group of scientists that are working on ketogenic diet research for mental health, and people who are funding this research, like the Baszucki family. If you could give a message to people from the bipolar community, to this community of people working in this area, what would your message be?
Well, first of all, I'd like to say thanks for taking an interest in this illness, because research is making a lot of difference, you know, and particularly this keto research seems to be a huge leap forward. And I would say that your potential to reduce suffering and perhaps even stop suffering in hundreds of thousands of people is, to me, very real. It's a very valid way forward. I mean, God bless SSRIs and mood stabilizers, but they haven't really evolved since the 1950s or 60s, or at a push the 1990s. But this area seems to just have an incredible ability to return people back to themselves without the side effects, without the really quite terrible side effects that a lot of SSRIs have. And so many people with bipolar, they find themselves in the situation where they're stuck between, they've started on the road of medication, and once you're on it, it's really hard to get off it, maybe impossible. And they're stuck between medication that really they don't feel very good on, but they're not ill, but they don't feel great on. And then you have this situation of, well, coming off medications, huge stigma attached to that, and the kind of the whole "you're an idiot for doing it" thing. And it's kind of like, well, where do you go from that? And keto seems to offer this middle way where people could still use the medication. It's not like it's necessarily going to stop the medication, but probably use a lower dose, I would hope. And for many people, probably an opportunity to actually come off medication and then fully live their lives. And if that isn't an amazing thing to dedicate your life to, you know, helping people to be genuinely happy, then I don't think there's not a lot better than that. So good on you, and thank you for your support.
Thank you very much. Thank you. I'll stop the recording here.